Good morning, everyone. Welcome to our special briefing today, co-hosted by Ethnic Media Services and the Vaccinate for All 58 initiative. I'm Sunita Sarabji, contributing editor at Ethnic Media Services and your moderator today. Panelists at our news briefing this morning will focus on 5 to 11-year-olds, one of the most vulnerable groups amid the COVID-19 pandemic. Statewide, fewer than 25% of children in this age group have been fully vaccinated. Speakers today will discuss parental hesitation, the safety of vaccines for children, recommendations for safe in-person learning, even as mask mandates end, and the mental health toll on young children. This afternoon, we are honored, or this morning, I should say, we are honored to host Dr. Jennifer Miller, who is a pediatrician at East Bay Pediatrics in Oakland, Dr. Sohil Sood, who is the lead for the Safe Schools for All initiative with the California Department of Public Health, Dr. Veronica Kelly, Chief of Mental Health and Recovery Services at the Orange County Healthcare Center, and Beth Jarosz, who is the Program Director for U.S. Programs and Deputy Director for Kids Data. Welcome to all our speakers and to media. Speakers, please speak slowly for our interpreters in Spanish, Korean, and Mandarin. Reporters, please enter your questions in the chat box. We will allow for 5 minutes of questions immediately after each speaker presents their remarks. We are live tweeting today's conference as well as live streaming in it, and we will send a video to all participants this afternoon, along with extended bios of our speakers and highlights of the briefing. And now we begin with our first speaker, Dr. Jennifer Miller, who will present an on-the-ground perspective of COVID's impact on 5 to 11-year-olds, parental hesitation regarding vaccines, and children, along with her advice to parents. She will also present information about the safety of the vaccines that we have. Dr. Miller, welcome.
Good morning. Thank you so much. I'm really glad to be here. Happy to be here with you all. So what is the impact of COVID on kids 5 to 11 in California? As you mentioned, only 26% of the eligible children have received 2 doses of vaccine and 33% have received 1 dose. So we're definitely seeing sick kids. I'm definitely seeing kids on the ground in my office that have COVID. And it's a very real thing. A lot of people believe that the kids don't get COVID. They don't get it, we're not seeing it. And what we find is that actually they are getting it. Not as severe of a disease in large part as adults, but they're getting it and they are getting sick. We know that thousands of children have been hospitalized with COVID. We know that hundreds of children have died from COVID. So we're definitely We're also seeing that we're also seeing complications from COVID. So kids are suffering from something called multi-system inflammatory syndrome. And this causes inflammation in many body systems: the heart, the lungs, the kidneys, the brain, the eyes. And these cases, while rare, are really impacting communities, largely the Black and Brown communities, and they're affecting children. Often these children are in communities where there's high incidence of obesity and chronic illness. And as of now, there's not a cure for this syndrome. We see that kids are missing school. They're missing their sports activities. They're not being able to participate in all the things that they like to participate in. And in communities of color, where often families live paycheck to paycheck, these caregivers have to be out of work to stay home and take care of their kids, sometimes for 5 to 10 days, and many of these families are not equipped to deal with this. These families also live in larger groups and larger extended families, which causes increased spread of the disease. So we're seeing that the kids are getting it, they're spreading it to their caregivers in vulnerable communities that are often high risk and suffer from chronic disease. We also see that kids do get long COVID. We don't fully know the extent of that disease, but we know that kids suffer from confusion, prolonged shortness of breath, just not feeling back to themselves, much more fatigue and malaise, We are seeing that in the older adolescents and teenagers. And then additionally, we've talked a lot about the mental health crisis in adolescents and older teens, but I see that in kids 5 to 11, we also see lots of incidents of anxiety and depression. I see kids that are worried about if they're going to get sick. They're worried about if their parents are sick. Now we're telling them they don't have to wear masks as often in school. They're afraid that if they take their masks off, they're going to get sick. So there's a lot more anxiety in the communities, even in elementary school. In the smaller ones, anecdotally, with the toddlers that I see, many of them were kept out of daycare. And so they're afraid to be in a room with me because they're so used to being with their parents all the time and not being with other people. So we're seeing lots of anxiety and depression as well. So knowing these things, knowing these kids are getting sick, knowing these kids are missing out on their normal activities, why are parents hesitating to get vaccines? I think that I find the biggest reason is because they're afraid. They're afraid of the consequences. They're afraid of what might happen to their children. I find that parents are more willing to get the vaccine for themselves. Sometimes they need to do it for their work, or sometimes they need to do it because they've seen other people get sick and have complications. And so more adults are willing to get it for themselves. But when it comes to doing it for their children, they find that they're just unable. Just a couple of days ago, I had a family in here, kids that I had never met before that were in this 5 to 11 age group, and the parents had not vaccinated themselves or the children and really didn't want to give the vaccine to the children. They said they were worried that, well, from their research, they had seen that the vaccine actually killed kids. And they were worried that if I gave them the vaccine, they were going to set their children up for a failure, that it was life-threatening. So they're worried about making a decision that's going to have poor consequences. They're worried about causing problems for the future for their children. They're not sure that the disease is severe. They're not sure that they believe that the kids are going to get that sick. And so why should they get the vaccine for their kids? Some families worry that it can affect the fertility or their reproductive years. There's no data that shows this at all. In fact, all of the data suggests the opposite. They're worried about long-term consequences of the vaccine. Also, we're not seeing evidence of that being a problem. They're worried about side effects for the vaccines, and I'll talk a little bit about the side effects that are happening. But they're just worried that corners were cut in the production of this vaccine. When all the data suggests, all the data says that this vaccine is safe. It's been rigorously tested. It's safe and effective. No corners were cut, and no steps were skipped in the approval of this vaccine. Families worried about allergy and anaphylaxis, although we're not seeing allergy or anaphylaxis in large numbers at all, thank goodness, with the vaccine. And then finally, I think families, especially in our Black and Brown communities, are not totally trustful. They're not totally trusting of the medical community and our recommendations on vaccines. And so they come, with a skeptical brain. They come questioning what we're doing and what we're saying. If I could give any advice to these families, and as I do give advice to my patients all the time, what I would say to them is, as I just told you, the vaccine is safe. It's been rigorously tested. By the time this pandemic is over, we're going to see that this is going to be the most studied vaccine in history because we're getting so many people getting this vaccine. Parents often ask me about side effects, and the side effect profile is similar to any of the routine vaccines that we give. They often will have fever. They often will have soreness at the vaccine site. Sometimes they can have some redness at the vaccine site. Sometimes they'll have malaise or headache, not feeling so well, fever. But these are normal signs that actually show that the body is building protection against COVID. So it's actually good to have some of these mild side effects. And these side effects are short-lived. They go away by themselves versus having COVID, you might have it for weeks and the side effects are much longer. The disease is not. The side effects of the vaccines are short-lived. The disease is not short-lived. So I mentioned that, yes, this disease is often mild in kids. It's not true 100% of the time. As we said, COVID can and does kill kids. it can and does cause hospitalization in children. So as a parent, if you can protect bad consequences from happening to your child, I tell parents all the time, wouldn't you do it? Why wouldn't you do it? We know that this is a vaccine preventable illness. We can reduce the bad complications from COVID. Why not give your kid this vaccine? And then finally, vaccines are free. It's important to remember that you don't need insurance, you don't need citizenship. You can get it from your pharmacy, you can get it from your doctor's office, your internist, or your pediatrician. It's widely available. So please get vaccinated. Please get your 5 to 11-year-olds vaccinated, because we want to be able to protect them and keep them safe.
Dr. Miller, thank you for your remarks. We have a number of questions for you. I will let Henrietta Burrows ask her question first. Henrietta, could you unmute yourself and identify your news organization?
Hi, Sunita. Thank you so much. My news organization is the East Palo Alto Today newspaper and the Talking with Henrietta television show. When you respond, Doctor, to the parents' concerns, does that change their mind in any way?
Sometimes, yes. Sometimes I think they just want reassurance. They want to know what I've seen, what I experience, on the ground every day, that I see kids get this vaccine, that I know that kids are not having complications from the vaccine, that I've done it myself, that I've given it to my family. So sometimes my patients just want that kind of reassurance, that they trust me, they know me, and I can encourage them to get it done. With this new family that I mentioned, they'd never met me before. And I knew that I wasn't going to convince them, because they came in with clear ideas about what they wanted to do. And in some ways, it sort of feels like political opinion. You're not going to change somebody's political group by talking to them. And so I knew that in this family's case, I wasn't going to change their mind. But I hoped that what I was saying was something that would stick with them, and that they would think about and look into, and hopefully down the line, they'll see me again and we can talk about it again, or they'll talk to other people again and it'll change their mind.
Terrific. Plachette Robertson has the next question. Plachette, could you identify your news organization and ask your question?
Hello, my name is Plachette, and I am with the SacCulturalHub.com as well as the Hub magazine. And so my question, Dr. Miller, I am vaccinated. My mom is vaccinated. She's in her 70s. So just on the news today, they've been talking about COVID and the vaccine, and they're talking about the 4th shot now. So a lot of us have concerns. Some parents may be scared. Some people are confused because now they're talking about a 4th shot. So I'd like you to kind of explain why is that, and, how can we better kind of inform our family members as well as our audience of, our different publications of this different talk about now the 4th vaccine. What does that really mean?
Well, some of this is sort of my experience and my opinion, I will say. My answer to that question is, many of us in the medical community feel that COVID is not leaving anytime soon, that it's going to be out in some way, shape, or form for a long time to come. And my understanding of why they're talking about there should be a 4th shot is because the longer we go after having a shot, the more our immunity tends to wane, the less our immune system is able to recognize it. The longer COVID is out and about in the community, the more it can change and avoid the current medicines and vaccines that we have for it. And so with each subsequent, the longer it is in the community, the more we have to protect ourselves. So I think many of us think that every 6 months, I think that it will probably end up being like the flu shot, that we'll have a flu shot every year and we'll get flu and we'll get COVID. It would be nice to go yearly and not have to go every 6 months. So far, we're sort of in a place where we're doing it every 6 months. And so that's sort of how I understand it. I'm not sure if Dr. Sood may have thoughts about that when he talks from the CDPH, but that's sort of how I understand it, that the longer it's around, the more it can change to try to avoid us, and the more we have to protect ourselves to be able to fight it off.
Thank you. Araceli Martinez has the next question. Araceli, will you unmute yourself and cite your news source?
Hi, this is Araceli Martinez with La Opinión, a daily newspaper in Los Angeles. I was trying to find out if you have an idea what % of the Latino children is vaccinated, and if you know how we are in comparison with children from other ethnic groups and white children.
So I don't have that data at my fingertips, but I wonder if one of our speakers is going to talk about that. I think she is. There are great resources, because I was looking this up for myself, that talk about state to state comparisons and also racial and ethnic groups. I looked up at American Academy of Pediatrics.com, and they give you a COVID vaccine page where they talk about children specifically and different racial groups and ethnic groups. And so I would point you to that. Okay, good. Connor is giving also another data point. So it is there, but I don't have that, I'm sorry, that number at my fingertips.
Thank you.
Thank you, Dr. Miller. I have one question for you before we move on to the next speaker, and that is, how long after the vaccine will side effects continue, and when should parents actually take their kids into the pediatrician? What signs would you recommend bringing your kids in?
So I usually find that it's a couple of days, 2 to 3 on average. I think depending on the age of the child, since we're talking about 5 to 11, if they're an older child, I would not worry for the first probably 5 to 7 days. Maybe the first 3 to 5 days would just be sort of normal vaccine side effects. If it's going along past 5 days, I think it's always a good idea to see your pediatrician. Most things pediatric are sort of 3 to 5 days, and the longer it gets past 5 days, the more we worry about other problems. So I'd say if you've gotten to 5 days after your vaccine and your child is still having some concerning symptoms, I would definitely reach out to your healthcare provider.
Dr. Miller, thank you so much for joining us today, and we hope to see you again.
Absolutely, my pleasure. Thank you for having me.
Thank you. We move on to Dr. Sohil Sood, who I introduced earlier. Dr. Sood will talk about how we return to school safely, even as mask mandates come off. Dr. Sood, welcome.
Thank you. It's a pleasure to be with all of you. And thank you, Dr. Miller, for your insights. I'm happy to speak a little bit about vaccines as well. But as Sunitha was mentioning, I'm the lead for the schools team at the California Department of Public Health. And so I spend a good portion of my days thinking about how to keep our kids in school and out of hospitals, and how to ensure that we're effectively mitigating transmission and protecting really school staff, parents, families, and California communities more generally.
Dr. Sood, I'm so sorry to interrupt you, but our interpreter has asked if you could please speak a little bit slower. Absolutely. Thank you so much.
Yes, no, sorry about that. Much like Dr. Miller, I am also a practicing pediatrician, and I practice in hospitals and have seen the many manifestations of COVID over the past 2 years from a clinical standpoint as well, and I'm happy to expand on that if there are questions. I'll just briefly say that my experiences really parallel everything that she was just saying around some hesitancy around vaccines and the many different reasons that folks express concerns or reluctance or appreciation for these conversations going forward. And I'm the father of 2 amazing little ladies who attend California schools, and I drop them off to school every morning, including this morning too. So today, let me just maybe take a few moments to discuss the recent data trends and to describe how this is influencing school-related mitigation policies. As you likely know, the trends in recent times are really quite favorable. Test positivity is down to 1.5%, down from a peak of close to 25%. And to say that another way, in a matter of months, we've gone from 1 out of every 4 tests done in the state of California being positive for COVID-19 to close to 1 in 100. That is a remarkable and steep downtrend. Case rates, similarly, today's numbers, I believe, are 7.6 cases per 100,000 individuals per day. And this 7.6 we can compare to the peak of Omicron, which was around 300 cases per 100,000 per day. So also very, very steep downtrends in cases. And similarly, rates of hospitalizations, rates of deaths from COVID-19 are all waning now. Excited to announce that now over 80% of eligible Californians have received at least one dose of a vaccine against COVID-19. This is not to discount the very important point Dr. Miller raised, though, about the differences we're seeing in uptake among age groups, including the 5 to 11-year-olds being really the lowest vaccinated group among those who are eligible. And so this trajectory is promising and in line with our modeling estimates from a few weeks ago. But I will also note that the numbers that I've mentioned are statewide and average. And the impact of this disease has been far from equal across California's communities. So we must acknowledge that there have been communities that have been harder hit by others, harder hit than others. And work is being done to address those inequities that have been exacerbated by this pandemic, and certainly more needs to be done. Happy to talk about some of the state's efforts on that too. However, given these favorable trends across the board, and based on this science, California's moved ahead with a number of policy updates in schools, and I'll take a moment to emphasize 3 of those. So number 1, starting this week, California transitioned from a masking requirement in indoor K-12 school settings to a strong recommendation. This means we are still asking students and staff to continue wearing masks, just as we stated for the general public a few weeks ago, but the state no longer requires that schools track and enforce this. That said, if any local health department or school district chooses to maintain a local masking requirement, we affirm and support their right to do so. And we've released a document providing a framework of items to consider when making such decisions. And happy to expand and take questions about this in a moment too. Number 2, we are also now strongly recommending that schools use or transition to using a notification-based model for managing students exposed to COVID-19 at school, instead of a quarantine-based model. So we call this group tracing, and I'll note it's not new. We first released this approach at the beginning of the school semester in January, but what is new is really a strong recommendation favoring this approach. And it essentially entails the following. So if someone in class has COVID, that someone should isolate. They should go home and they should stay away from others, as described in broader CDPH guidance. But for others in that class exposed to that individual, they can and should stay in school. They should be notified of the exposure. They should wear a mask. They should get tested a few days later and be on high alert for symptoms, but they can remain in school. And the reason for this is really that Omicron is quite different, with shorter incubation periods, with wider spread transmission. We need to rely on approaches that match that. And this approach of more rapid notification, broader notification, rapid testing, and rapid isolation matches that better than trying to identify and potentially quarantine those within a specified 6-foot radius. So again, this has been around since the beginning of the semester, and schools did adopt this really going through the Omicron wave. And we've now, as I mentioned, seen a nice downward trend, and many schools are continuing to use this approach, and California is now strongly recommending it going forward, in line with what the CDC is now stating as well in terms of their approach to contact tracing. And the third point I wanted to highlight is California is going to continue leaning heavily in on supporting school communities. So this change in masking guidance does not accompany any backing off of resources. And if anything, allows us really to focus on longer term prevention strategies. And the main one there is vaccinations. So as it stands right now, any school in the state that wants to host a vaccine clinic just needs to contact us, and we'll work with them to sort all the details out and get it done. They can also work with their local health jurisdiction and a number of fantastic community-based organizations. So there's a number of entities working hard to ensure that these children, and the 5 to 11-year-olds in particular, can get access to being vaccinated. It also includes supporting school efforts to optimize indoor air quality. In fact, my next meeting after this one is with county education and health officials, and we're spending the entire time talking about ventilation guidance, around funding sources to support implementation, and sharing experiences from California schools who've made substantial improvements throughout this year. And we also continue to provide ongoing robust supportive testing programs. So this includes testing done at schools and providing tests when available for kids to take home. So in summary, I think we're taking steps in the right direction. We've come a long way since schools were first shut down 2 years ago. Speaking as a parent, my daughter spent her entire kindergarten year virtual, and so I'm very happy that her first grade year is going much more successfully in person. And by and large, California has demonstrably mitigated transmission in schools. When we compare our outcomes compared to other states, looking at pediatric hospitalizations, looking at school disruptions. And as we move ahead, we plan on continuing to support safe in-person schooling by really providing the right mitigation framework that supports the active challenges we face. And so with that, I'll conclude and happy to take questions.
Dr. Su, you talked about the downward trend, and I wondered to what you attribute that to, even as mask mandates come off.
Yeah, it's a very important question. So I'd start by saying that the downward trend preceded the changes in masking guidance. We wanted to ensure we were clearly on this downward trajectory before really changing any requirements, both for the general public and in schools. And really what's been the case is, to some degree, there's been a large amount of infections, as everyone knows, and that has caused some degree of protection and immunity for the population. But also, we've noticed a ongoing uptick in vaccination throughout the Omicron surge, and even through today. Numbers continue to trend up, in some cases more slowly than we'd like, but those go up. So immunity continues to be important, and as more people get protected, we'll see less cases. And so that's part of what we're noticing. And maybe the third piece I would add with that is increasing recommendations for boosting in populations that are eligible for that.
Absolutely. Henrietta Burrows has the first question. Henrietta, please ask your question.
Thanks again, Sunita. Dr. Sood, it just so happens as things are relaxing in this country and maybe in some other countries, there's a new variant, BA2, that's the successor to the Omicron variant, that's causing more hospitalizations and deaths in Europe and Asia. So the fear is that what's happening in Europe and Asia is going to be spreading here as more travel is allowed to take place. So is there any concern for the California Public Health Department that things might change and maybe change quickly? And what precautions might currently be being recommended from your department?
Thank you for the question, Henrietta. I think if there's anything we've learned over the past 2 years, it's to be humble to this virus and to understand its challenges and in some cases lack of predictability. And so all of that merits ongoing really close surveillance. And California is doing that. So and it's frankly part of the reason too, we haven't gone from a mask requirement to what is sometimes stated as an entirely optional strategy. It's still a strong recommendation in many settings. And we're asking communities and the public to continue wearing their mask. Specific to the BA2 variant, we're tracking this closely, and it is rising as a proportion of cases, both in the US and in California specifically. So even though that downtrend is continuing to be the case, which is good, the proportion that are BA2 is increasing within that. And so we need to continue to be vigilant. And we are watching what's happening in Asia and what's happening in Europe. And I'll just note, it's hard to perfectly analogize, exactly the implications of what's happening there on what may happen in the US and in California, because every country has taken a different approach. Different vaccines with different efficacy is used in different settings. Different testing strategies are used, and different mitigation approaches are used as well. So we need to continue to be careful, and we need to be able to pivot and consider all possibilities remaining on the table going forward. But it doesn't mean that we can't harness the reality and the science of this moment as being one of relative calm in California and hope.
Thank you.
Jean Ho has the next question. Jean, could you identify your news source and ask your question?
Sure, of course. This is Jean from News for Chinese. And my question is that you mentioned the fact that California at large, already has the strong recommendation for the K-12. However, the local schools or the school district, they still have the right to make it masking mandate for their particular region. Now, my question is that how far are they allowed to execute this kind of decision? For example, if a parent or family says that, well, no, I do not want my child to wear a mask, does the school district actually have the right to say, oh, well, then your child cannot come to school? I'm just curious how far they can push this, because after all, California says it is, recommended, not required.
Mm-hmm.
Excellent question.
Yeah, I appreciate the question. Unfortunately, I would have to defer that question to the school districts themselves regarding enforcement. So if they're putting a local requirement in place, then they would be establishing the parameters for enforcement and repercussions for that, which would of course be a conversation that needs to be in compliance with California law more broadly as it relates to exclusions from schools and other enforcement activities, but also would be subject to exactly how they're choosing to create that particular guidance for their community.
And Dr. So just to follow up on Jean's question, there's such wide disparities in vaccinations for this age group. In Marin County, for example, 58% of 5 to 11-year-olds are vaccinated. In Kings County, it is about 5%. Should school districts have the ability to impose their own requirements?
Well, yes, I think they should have that ability, and they do by and large have that ability. What I'll try to do is paste in the chat some of the considerations that California's put forth for local decision-making to occur. And one of those is vaccination rates. Another is, local case rates. Community input, we think, is also important into this conversation. So thinking both about the pandemic and the pathogen, what's happening with the virus itself in that community, thinking about the other protection measures that are in place in the schools. So how do vaccination rates look? How do indoor air quality look? What is the degree of a program? And the people that are going to be ultimately impacted by some of these policy decisions. What is their input into this process? That's part of the framework that we put forth for supporting local decision-making around this.
Dr. Sood, thank you so much for your comments, and we hope to see you again. We next welcome Beth Jarosz of Kids Data. Beth, welcome. Thank you for joining us today.
Hello, thank you for having me here today. I have some slides I'm going to try to share. Bear with me for just a sec. Do you see the slides? Okay, perfect. So hello, I want to thank you all for inviting me to this esteemed panel. I am Beth Jarosz, and I work at PRB. I'm program director, and I work on issues of population health and well-being in California. One of my projects is Kids Data, where we track child well-being for counties, cities, school districts, and legislative districts in the state.
Just a bit slower, Beth.
Sure. And today I'm going to share just a bit about how young children have been doing since the COVID-19 pandemic started. I will start with all children under age 18, and we'll share data for ages 5 to 11 where possible. And then I'll show you where you can go to find more information. First, although public health restrictions are easing, it's important to remember that the SARS-CoV-2 virus is still circulating. What you see in light blue on the bottom of the screen is the cumulative number of child COVID deaths by the end of 2020, by the end of 2021, and as of March 13th, 2022. The dark blue line shows the cumulative number of COVID-19 cases for each of those periods. Nearly 1.6 million cases since the start of the pandemic is substantial. As you heard earlier, this means children who are getting sick, who are at risk of multi-system inflammatory disease, who are missing school. And that works out to more than 1 case for every 6 children in the state. And what might be even more startling is that when we look at the number of new cases per year, there have been more child cases of COVID in the first 2.5 months of 2022 than there were in all of 2021. And if we look at the death data the same way, the number per year rather than cumulative, we also see a troubling pattern. Although children are less likely than adults to die from a COVID infection, more than 30% of child COVID deaths across the whole pandemic in California have happened just in the first 2.5 months of 2022. So even if this pace slows, 2022 could well be the worst year of the pandemic for children. One way to prevent child COVID deaths from rising would be, of course, to get more children vaccinated. This chart shows vaccination rates first dose for children ages 5 to 11. California is ahead of the national average at just over 30%, but both California and the nation have less than 1/3 of children ages 5 to 11 fully vaccinated. Perhaps even more importantly, you can see comparing the top 4 and lowest 4 counties in the state that there's a really wide range of variation across counties. We know that there have been vaccine equity issues nationwide, but I want to highlight something interesting in California. Someone earlier on asked what the rate of vaccination was among Hispanic and Latino children in the state. And although I did not find that data ahead of this meeting, we do know that Black and Latino people in California have lower vaccination rates. But you'll notice Imperial County in the top 4, and I want to point that out as a success story. Imperial County, for those of you who don't know, is an extremely agricultural county with very, very high unemployment rates, and nearly 40% of public school students in Imperial are English language learners with Spanish as their primary language. But yet they're in the top 4. Clearly, they're doing something right. There are lots of questions about how they've gotten such a high vaccination rate, countywide and among children, but a lot of the understanding is that it has been partnership with trusted community partners, and that those trusted voices, as it's your trusted pediatrician, as we heard from Dr. Miller at the beginning, it's the trusted community leaders that really seems to have made a big difference in Imperial County. And one of the other pieces to point out, in addition to the good news of Imperial County's success story, is that really the gap that I see, yes, there is a gap by race and ethnicity. Yes, there are gaps by age, but there are really big gaps in between the coastal counties and the more inland and rural counties in California in terms of child vaccination rates. And to me, that's more striking than any of the other gaps that I've seen. But almost everywhere, including in places like Marin and Alameda and Imperial, there's great room for improvement in terms of child vaccination. Thinking more broadly about the effect of the pandemic on children, was there any good news? We don't yet have data from 2021, but in 2020, we know that fewer children went to the emergency room or were hospitalized, and deaths did not rise in that first year of the pandemic. And we think that's because lockdown measures reduced children's exposure to risk from many sources. There were fewer car trips, there were fewer illnesses. People were less likely to come into contact with the flu that year, for example. But when we start to look into the mortality details, there are some troubling trends. Here, we see child deaths for ages 5 to 9 in dark blue on the bottom, and you see no increase in 2020 or 2021. But at ages 10 to 14, shown in the lighter blue, we see an increase. And it's largely because the number of suicides rose dramatically for 10 to 14-year-olds in 2020, as did the number of accidental deaths, which includes traffic deaths, drowning, and poisoning. And poisoning is often overdose. So there are some real signals here in this data that suggest that there are mental health challenges even as young as age 10 in California and nationwide. The suicide rate, which is not shown on the slide, nearly doubled in California 10 to 14-year-olds between 2019 and 2020.
Beth, I'm sorry to interrupt. Our interpreter asked if you could speak just a bit slower.
Yep.
Thank you.
And unintentional deaths rose by 40%. So while there is some good news, there are still some very troubling trends. And so where can you, although I have just a few minutes today to share just a few pieces of information, I want to say that we are continually updating kidsdata.org with the latest, and I'll walk you through how you can get that information. If you visit kidsdata.org, you'll find more than 900 indicators of child health and well-being across the state. On the main page, there's a quick link to a special survey we published on family experiences during the pandemic. And this survey includes information about child mental health and family stressors during the pandemic. We also have an easy to navigate system for data by topic. If you click on data by topic, it brings you to the list of topics we cover. If you click on a topic, it expands to show subtopics. And then if you click on any one of the blue links for those subtopics, it brings you to the latest data for that indicator. You can also search for data for a specific location using the by region feature. And we have options for data by demographic group. But the most important way to keep up to date with the latest information is by subscribing to our monthly newsletter. And I'll share that link in chat. And I want to mention for that survey, we are hoping to field a fourth wave of another round of surveys to check in with families and how they're doing their health, their mental health, their stressors. And we expect to have data out on that later this year. And last but not least, a handful of data resources that may be useful to you, and Sunita can share these slides with the group after this call. And I'd be happy to take questions.
Terrific. Beth, where can we as reporters who work with various ethnic media outlets find data specific to our ethnicities? Is that available in this portal?
Yes, the Kids Data website does have data for different racial and ethnic groups. There are some limitations, sometimes, for example, for American Indian, Native Americans, and people in tribal areas. The survey sample size is quite small, but in general, we produce as much data by as many detailed demographic categories as we possibly can.
Araceli had a question about the rates of for the Latino population. Is that available on this site, and can you show her where to find it?
The current vaccination rates are on that the states, which I think was posted in the chat earlier.
Right.
And so the data that you see in my presentation is from there. We have not yet posted those data on Kids Data, so I would go, because the state is updating those statistics every day, I would go to them for the most current information.
You had presented some data from 2020. Do you expect the data to be different for 2021?
Yes, and so it depends on which topic we're looking at. There are some mortality data coming out from 2021 already that do suggest continued concern about child mental health. And there are some ways in, I think actually we may see bigger challenges in 2022 with family stressors, as things like the child tax credit, the stimulus payments are ending. There may be more family stressors, and then that, of course, has an effect on child's health and well-being.
Thank you. Henrietta has a question for you. Henrietta?
Thanks, Anita. Are there explanations with the data? For example, you mentioned child suicides, like some of the reasons behind the suicides or the way the suicides were committed.
Yes, for each of the indicators on kids data, the data are at the top, and then at the bottom, there are several pieces of contextual information. So explaining the latest research and why this topic is important, what the policy implications are, and then a summary of how children are faring in the latest year. So yes, the website does have all of that information.
Araceli wanted to ask additional information about her question. Araceli?
Yes, hello. Yes, I tried to find that numbers, but I couldn't find them. But I also would like to see if you can elaborate about the challenges that different ethnic groups have been go through in regard to the vaccine for these children.
I think, number one, please feel free to send me an email and I can help point you to the data that you're looking for. I'm happy to do that. And then with respect to difficulties with access to vaccines, there are everything from parental concerns, as you heard Dr. Miller talk about at the beginning, and misinformation out there, everything from that to just not having a car or time to take off of work to get your child to the vaccination clinic. And so there are a wide range of reasons, and that's partly why I think looking at Imperial County's success story is so important, because they were able to overcome those challenges for many of their residents.
Fantastic. Beth, thank you so much for joining us today. We hope to see you back again.
Thank you.
And we move on next to Dr. Veronica Kelly. Dr. Kelly, welcome. Dr. Kelly will be discussing the mental health challenges 5 to 11-year-olds face during this time. Welcome, Dr. Kelly.
Thank you very much. So our kids ages 5 to 11 for this discussion have been impacted by COVID-19 in both obvious and less obvious ways. They have experienced an increase in isolation over the past 2 years because of the way they've changed how they attended school. So they're sitting at a kitchen table with a Zoom and they aren't surrounded with their friends. They interact with their friends and other adults differently. And we've changed the way in which our children have accessed healthcare because we haven't been able to go to the doctor. And that may have led to symptoms of increased depression and anxiety, as Dr. Miller pointed out. And what we've seen nationally, according to the American Psychological Association, is a 24% increase in 2020 for emergency department visits for children age 5 to 11 for a mental health crisis. And then this past year, 2021, children's hospitals have reported a 14% increase in mental health emergencies. And as Beth just pointed out, a 42% increase in self-harm, which includes suicide attempts. Our kids have experienced many losses, including missing the first day of school, changes in their friend group, missing graduation, even if that graduation was from kindergarten. They've missed participating in sports and other ceremonies like quinceañeras and baptisms, and even the loss of a parent or a caregiver to COVID. About 167,000 children lost a parent or caregiver to COVID. Additionally, our kids have experienced a loss of innocence with a national reckoning over social injustice in our Black and Brown communities and increased hate crimes in our Asian and Pacific Islander communities, increased violence and polarization of America. So our kids have had to grow up fast. And this has resulted in something we call sustained survival mode, which means that when we were locked down, we didn't have a whole lot of activities to do, and we didn't have a lot of healthy things to eat, so we made do. But those continued unhealthy behaviors have led to a decrease in our mental health, decreased physical activity, disrupted sleep, increased weight gain, and a very big increase in concern from parents about their kids. 2/3 of parents surveyed by the American Psychological Association reported concern about the pandemic's impact on their children's cognitive development. And 57% reported that their child could have benefited from mental health treatment during the pandemic. And finally, trauma is cumulative. That means it piles up, especially in kids. And unless we treat it, it can be triggered by significant events like the pandemic. And then for those of us who are also impacted by historical trauma, the risk for mental health issues is unfortunately woven into our DNA. Kids who have experienced adverse childhood events like abuse, neglect, community violence, and discrimination, family disruption before and during the pandemic are at a higher risk for continued mental health problems. And we also know that kids of color and lesbian, gay, bisexual, transgender questioning kids, low-income kids, kids who are growing up in an immigrant household, and youth who are involved in our criminal justice and our child welfare systems are also at higher risk for mental health impacts. But there is good news, some. 50 years of research, according to the United States Surgeon General's report on protecting youth mental health, shows that increases in distress symptoms, like our kids have experienced, are common during disasters, but most people cope well and do not go on to develop mental health disorders. But for kids, here's some things kids can do. For children 5 to 11, remember that mental health challenges are real, they're common, and they're treatable, just like all other healthcare issues. There are many ways to get better, and kids should ask for help. Ask someone you trust. If you're having trouble controlling your emotions, if you feel very sad, feel like you can't stop crying, then reach out to a trusted adult, the school nurse, a teacher. It takes courage to do this, but it makes a difference. Build healthy relationships. Making friends and keeping them is very important. Get involved in activities to make more friends because our friend groups might have changed. For kids also to find a way to serve. Sometimes it makes us feel better when we help others. For parents and caregivers, pay attention to your own reactions. Kids take their cues from how to behave from us. So if we are angry and nervous about masking or vaccination, they will be too. Kids pick up a lot more than we think. Help your kids build strong, safe, stable relationships with you and other supportive adults, because research shows that the most important thing a kid needs to be resilient is a committed relationship with an adult. Do your best to provide your kid with a stable environment at home, because kids are sponges. They internalize stress, so pay attention when you start talking about financial concerns or marital concerns in front of them. Try and take kids for a regular medical checkup and look for warning signs, and then seek help when needed. Distress in kids can show up as irritability, anger, changes in their behavior, changes in their sleep patterns. So if you see something, let your kid know that you are there, and don't be afraid to ask a health professional for help. There is a lot of free resources available through every county, every one of the 58 counties in this state. Minimize access to means of self-harm. We saw that the rates increased. So if you have guns at home or prescriptions, you need to make sure that they are kept away from kids. Dispose of extra medications that you have in your house. And if you have guns, lock them up and keep the key away from your children. Be attentive to how your kids spend their time on the internet, because it is a way to connect, but it's also a way for bullying to happen and for overexposure to happen to very stressful scenarios. And finally, be a voice in your community. Talk openly, like we just did, about mental health, because we all have it. Our kids and our families can and do recover. Thank you.
Dr. Kelly, thank you so much. I have a couple of questions for you. So, traditionally, if the home environment was the issue, kids could go to a school counselor, to their peers to help them resolve that. What happens when those types of resources are not available for children amid the pandemic?
We did see an increase in negative impacts to children, in particular with child abuse and other types of bullying that happened in the home. But the people who could report it and get help were not there. So like Beth had stated, we believe we're going to see an increase in calls for assistance as we come out of this stage of the pandemic.
And we have addressed this issue before at other briefings, but could you talk a little bit about the lack of culturally appropriate mental health providers? Because that is such an important piece of this conversation.
Yes, absolutely. I think the good news is that county mental health providers have a requirement that says we have to work with our community providers who do this better than we do. But commercial insurance providers, so if you are lucky enough to have Kaiser or Blue Shield, you're going to have a lot harder time finding someone who can speak in a culturally with cultural humility and address cultural needs. The resources are out there. I think what the state of California is starting to do is to increase access to contracts for local communities of color so that we can help fund services for our community. Most of us, people of color, know how to do this. We just don't have the support to do it. And we need to, as we're doing here, speak about this. My mother's from the Philippines. I was not born in this country. And if she knew I was talking about mental health, this would cause her some anxiety culturally. But I do it anyway. And we have to all do that. We have to start talking about this because our communities are dying.
Thank you, Dr. Kelly. I would like to ask each of the speakers remaining on the call, Dr. Sood, Beth, and Dr. Kelly, what is the most important thing that you would like us as reporters to take away from this conversation? Dr. Kelly, let's start with you.
The most important thing I would say, taking from this conversation, is that mental health impacts us all, and we have to address it. We have to talk about it. And mental health is more than medication. It's about physical activity. It's about finding joy in the world. So again, our kids and our families can and do recover.
Thank you so much, Dr. Kelly. Beth. I don't know if Beth is still with us. Dr. Sood, would you like to give us your 30-second soundbite?
Sure. I'm very appreciative to be on this panel, and I, would add to what Dr. Kelly was just mentioning by saying, I think she's also speaking to the importance of keeping schools open for the well-being of children overall, including their mental health. And then more broadly, I think going forward, it's going to take all of us working together to keep this virus at bay. So I'm confident Californians will proceed with love and respect for one another. And step up and get vaccinated and take care of each other.
Thank you so much. To all the speakers and to the reporters who joined us on this call, thank you so much for joining this very important discussion. And we'll see you on Friday. Take care.